Finally, the long wait is over. It is time to receive your newborn baby. You're super excited. You have everything in place, baby layette, baby cot, everything is in place. You hear the baby's first cry. You get to see your baby. But after seeing your baby, something doesn't seem to make sense. One or both of the feet are unnaturally curved inward at the ankle joint, and the toes are pointing up. Is my child disabled? Well, today we'll be talking about a condition that affects newborn babies, and it is one condition that targets the ankle joints. It is clubfoot, or also known as Tallipes Equinovarus. So, what is clubfoot? Clubfoot is a congenital condition, meaning the child is born with it, and it is a condition in which the Achilles tendon is shortened. The Achilles tendon is a tough, fibrous tendon which is found behind the ankle joint. Now, what causes this shortness? There is no known cause to Achilles tendon shortness that could result in clubfoot. However, it is also good to mention that the condition is twice as common in boy children as compared to girl children. Now, what are the options now that my child has got clubfoot? Well, what I can say is immediately you notice something unusual with your child's foot, rush to the hospital, let your child be assessed and examined. Sometimes it could be a very small case to handle, other times it could be one that would require surgery. But I say small case without surgery. Yes, small case without surgery, it would require your child to be put in a cast, also known as a POP, or in our local language, chitute, on the foot, just so to correct it. I must also mention that clubfoot does not go away on its own without any correction. That's why it's very important when you notice something wrong with your child's foot, you go to the hospital and let it be corrected. Unfortunately, there are some babies who are born in the communities, who are born from home, and maybe their mothers cannot really identify or they haven't noticed anything wrong with the foot, or maybe they could, but then they think, my child will be fine as they grow. Well, like I mentioned earlier, clubfoot does not self-correct without any treatment or management, and it is always best to seek medical help as soon as you notice the problem, because the older you let the child grow, the bones and the tendons could get used to be in that same position, and that could be a little bit more challenging when it's time for correction. If they'll be using casting to correct their feet, with good manipulation, their feet should come back into normal at least within 4 to 6 weeks. If within this period the correction does not happen, then they can go on to have a small surgery performed on the Achilles tendon, which is going to correct their foot. Sometimes the surgery could be a little bit more extensive, but let us always make sure to stick to the guidelines and advice that will be given by the medical health practitioners. After surgery, your child will be expected to wear some special shoes until they are aged 4 or 5 years old. But for the first 3 months, they will be expected to wear the special shoes for most part of the day, 23 hours per day, and you only remove them for 1 hour, during which they should be bathing and just some gentle, relaxing. Otherwise, they'll have to spend the first 3 months fully in their orthopedic shoes. That will be one of the only times that you allow your child to go to bed wearing their shoes. In other cases, especially when the parents do not fully adhere and strictly adhere to the instructions given by the healthcare practitioners, the foot of their child will go back to the way it was originally. So it's very important to strictly abide by the rules that your healthcare advisors give you. For as long as you just follow the instructions given, your child's foot will come back to normal, and nobody in future might even notice that there was something wrong with the child. I must also mention that as parents, you should not be harshly alarmed when your child has got clubfoot, because it is one common condition which can easily be corrected, especially if you just adhere to the instructions. All right, enough for today. Please, if you have any comments, questions, or contributions, don't forget to send them in the comment section. I'll be very excited to read them. Don't forget also to hit the subscribe button. Until next time, bye.